name's Carrie Furry, and I'm the long-term care pharmacist here at Bay Pharmacy. Well, long-term care pharmacy basically helps supply medications and patient care to different facilities in the area, and actually we serve some facilities all the way out to Daytona, to Kissimmee, up to Ocklawaha. So facilities like assisted living facilities, group homes, behavioral facilities, prisons. As a long-term care pharmacy, we receive prescriptions or orders, depending on what the facility is, for different medications. The technicians fill the prescriptions by looking at the actual prescription that was sent. They type in the information, print labels, and those orders are filled either through bubble packing or through TCG packing in strips. And then when they're done with that, they go to me to be verified so that we can see that the right medication is going to the right patient in the right dose for the right time. With the packaging that we have, whether it be with the bubble cards or the TCG machine, in the bubble cards we have patient label on it, which has the name of the patient, the name of the drug, the directions. Each medication is sealed in a sterile bubble so that it is safe, it is not contaminated until it is popped out and given to the patient to take. With the TCG strips, we have all the medications for a certain time period. We can have up to 5 medications per bubble in one pack, in one little bubble pack. It has the patient's name, the time of administration, whether it's 8 a.m., 12 p.m., whatever time it is, the names of each medication, and how many of each medication are to be given to the patient. So in that case, it's easier for the nurses or the med techs to deliver the medication. They will just rip that strip off of the patient's longer strip, open it, give the patient their medications, and all the medications for that time are in that one package, instead of having to pop out from 5 different bubble cards. So that is a more efficient way of doing a med pass. It also cuts down on the medication errors because we have verified. Later on you'll see on our machines how we scan, how we take pictures of every single medication that is sent out so that we can verify that the patients receive the right medications and the right quantity of each medication. Part of our personal service deals with each individual facility is assigned to a specific technician. Each technician has a list of facilities that they personally will take care of. So if Nurse June at XYZ facility decides that they want to call in and verify medications for Mrs. Smith, they will call and speak to Naomi, because Naomi is their specific technician who's assigned to that facility. They will reach a person every time. It's a wonderful service, and it's nice to be able to speak to a person and not have to deal with being rerouted and pressing 1 and pressing 5, and if you want this. MARS, or medication administration records, can be printed monthly for each facility. Or we also have electronic MARS available, which are all in the computer, so you don't have to write them manually or they don't have to be typed. The printed MARS are updated by our technicians regularly and sent out on a monthly basis with the most updated dosages and the most updated medications for each patient. Other facilities do offer MARS, printed MARS. However, we offer the personalized service of having the same technician print the MARS for their specific facilities. So if there's an issue with any MARS or any changes, the nurses can call their specific tech directly and get it changed right away. Each technician is assigned to one facility, so that technician will know what the specifications are for that facility. Every order or prescription that comes into the pharmacy is first filled by the technicians, then it is packaged, and then it comes to my station for verification. At that point, I will verify that the right patient is receiving the correct medication in the correct dosage at the correct time, and that there are no errors. If there is some discrepancy, at that point we will catch it and have it corrected before it leaves the pharmacy. In addition to the prescription medications that we have here at Bay Long-Term Care Pharmacy, we also carry a wide variety of over-the-counter medications, ranging from ibuprofen to anti-nausea medication and even more. In addition, we also have incontinence products, including bed pads, including wipes, including creams. Our technicians are also capable of handling a wide variety of insurance claims and billing. They will bill for all the different medications, and they can also handle prior authorization requests. They contact the doctors and the insurance companies to try to get the patient the medication that the prescriber wants them to take. Part of the services that we offer is helping facilities come up with a formulary that will help them meet the needs of each and every patient in a cost-effective way. Our pharmacy also offers 24-hour emergency on-call service. So if something happens at 1 in the morning, you can give us a call and we will go ahead and prepare the medication and deliver it to you. We deliver medications and cycles to our facilities, and we also deliver to certain individuals who are unable to come to our pharmacy. We have 3 consultant pharmacists and 1 clinical registered nurse on staff. We offer a wide variety of educational programs, including those for the Agency for Persons with Disabilities, cardiopulmonary resuscitation and first aid, Alzheimer's training, and assistance with self-administered medications. One of our partners is DocuTrack, a state-of-the-art document tracking system to keep all of our prescriptions in order. Another partner we have is TCG. They help us facilitate medication administration to different patients at the facilities. Bay Long-Term Care Pharmacy is the only pharmacy in Lake County that has the technology of TCG Rx packaging for pouch packaging medications. Their packaging machine houses 384 medications that are most widely used at the facilities. Another advantage to our TCG Rx technology is when patients go home for a family day, or if they go on a family vacation, they can take their medications with them. Instead of taking an entire strip or an entire bubble card, the number of days the patient is going to be gone can just be torn off and handed to the patient or the family members. If patients need medications that are not housed in our large TCG Rx machine, these medications can be packaged in trays separately. The trays can then be inserted into the machine where the medications are added to the other medications. When we provide the TCG strips to the facilities, the strips are first packaged and then they are run through our Inspect Rx machine, which takes 3 different types of photographs of each bubble pack. We have infrared photography, ultraviolet photography, and regular digital photography. All of these images are then transferred to the pharmacist inspection station, where all of the medications and all of the bubbles are verified for accuracy. These images are then stored, and if there's ever any question in the future, they can be pulled up for verification. We also have a fully accredited compounding pharmacy in the same building with us. This allows us to provide specific medications for certain patients who can no longer take oral dosage forms. We can provide topical alternatives or customized alternatives depending on each patient's needs. This is where it all begins. Our technicians are diligently taking orders in, typing them up, filling them so that we can package them and send them out to the facilities. All orders and prescriptions are saved in our DocuTrack system. Our technicians then type up the prescriptions and send them to be packaged. All of the information in DocuTrack is also visible to the pharmacist for the final check to verify that everything is accurate. Here we're packaging our punch cards. This particular punch card has 31 spaces for 31 days. The medications can be packed from 1 day, 1 week, up to 31 days. Safety is our top priority. Our TCG Rx adherence packaging helps reduce medication errors and simplifies medication adherence times. This machine behind me houses 384 medications that are the most commonly used by our facilities. Our TCG Rx adherence packages also meet all the requirements of ACA. When an ACA agent visits the facility, the medication technician or the nurse can simply read off the information on the medication adherence packages and comply with all requirements. This is our TCG Rx verification station. All of the adherence packages that are printed are run through our Inspect Rx machine, where pictures are taken with infrared cameras, ultraviolet cameras, and regular digital cameras. Those images are shown here on the computer screens. Anything that needs to be verified is highlighted in yellow. All the green packages have already been verified by our machine. If there is something that needs to be corrected, it moves on to the correction station, where medications are corrected and photographs are taken again so that we can see what is actually sent out to the facilities. Our TCG Rx adherence packages get inserted into the Inspect Rx machine, where all the photographs are taken. The machine can identify all of the tablets and capsules that have been programmed into it. If it cannot identify a medication, then the image is highlighted at the pharmacist verification station. This is our quality assurance station where the pharmacist will check all medications before they go out for delivery. We do the punch cards, we do bulk items, we will verify all medications that come in. This is where our deliveries get processed. The delivery driver will collect the tote, verify that all the medications are in the tote that need to be in the tote before they leave for the facility. Each order that gets sent to one of our long-term care facilities goes through 5 different inspections to verify that everything is correct. That's just one more way that we ensure safety, accuracy, and reduction of medication errors. We're a family-owned company, which makes it easy for us to give that personal care that some corporate or other companies don't have anymore, unfortunately. We care about each individual patient, and we want to make sure that they get the right medications and that they're taken care of. Bay Long-Term Care Pharmacy has been around for almost 40 years. In that time, we have built relationships with different facilities, with different nurses, and we look forward to continuing those relationships. The reason we're still here is because we offer that individualized service. We find out the needs of each individual facility, and we help to meet them. We would love for you to visit our website or just give us a call for more information.